Okay, thank you. So I'm going to talk a little bit right now just about our forensic peer support services as a whole. One of the things we had to really educate folks on in Pennsylvania was that when we say forensic peer support, somehow people started thinking that means just in jail. They would tie forensic to meaning in jail. But really, the bigger picture of forensic peer support is what happens out in the community. So we really have two prongs to our forensic peer support program. The first being in jail when we're doing reentry services, but the bigger bulk of our forensic program occurs out in the community, either in diversion when possible or at reentry and ongoing probation and parole supervision. So just on this slide, a couple of things I just want to highlight to you, and then we'll move on, is some things that we specifically designed within our community and jail programs. Similar to traditional, what I'll say traditional peer support, non-forensic, is we're looking at recovered individuals who've successfully recovered from mental illness and now help others. That's the basis of our model. Way back when we started this, and the state did not recognize originally forensic peer support, it was peer support is peer support is peer support no matter who you provide it to. But we took that and said we're going to design a training curriculum and a program that looks at those dual stigmas when somebody in peer support who has mental health issues also has that involvement in the criminal justice system. One of the other things we designed differently in our program and has helped us be successful and has been a bit controversial is a higher level of supervision for our certified peer specialists. Not to take the keys away from the peer specialist being the expert, but to support them in being able to be a peer specialist who's now doing a job and has employment responsibilities, so that our supervisors are there to support the peer specialists who are the expert so that they can maintain their own recovery, that they have some clinical input for very difficult situations that they may not have dealt with in their own personal recovery, but need to be able to support individuals who are going through those things. So that's been very successful for us, and what we find is most peer specialists who come to us, who've maybe worked at other agencies where the peer specialist is the expert and you have the bare minimum supervision, and when they come to us and we say, okay, it's a little bit different, we do provide a higher level of supervision, we get thank you so much. Thank you so much for not making me do all the paperwork and be the clinician and the peer specialist. You're letting me just do my job and supporting somebody and let my supervisor handle all the administrative garbage that comes along with it, especially when you're a Medicaid funded program that you have to just do. Couple things here. On this slide it talks more specifically about our community program. I'm just going to highlight a couple things. Dr. Nulton referenced this first bullet point. So what we did at Peerstar is we looked at a lot of different models. We sent people to the Drexel training to learn about the sequential intercept model. We had Yale come and do a 3-day peer support training. We looked at what was happening in Arizona and Georgia, and we said, what's going to work for Pennsylvania? And it wasn't a one-size-fit-all. The sequential intercept was really great because it taught us what you can do at different stages in the criminal justice system. Our training from Yale was really great, and it gave us some really hands-on practical approaches of if you're supporting somebody coming out of jail, here are their needs. But neither one met all of the criteria. So we developed our own internal policies and procedures based on regulations in Pennsylvania specifically. And then we took what we thought was practical approaches. What do our staff need to know? Because we kept getting the question, what am I supposed to do? I went to my certification training that talked about how to be a peer specialist, but I don't know anything about the criminal justice support side. Or I know what I did, but I don't know what works for everybody. So that's where we designed that specific program. Just going to move forward. So what do forensic peer specialists do? They do a lot of the same thing that a certified peer specialist does. They model ways to advance their recovery. A couple of unique things they do is they help to break some attitudes and beliefs that occur when somebody's incarcerated that maybe aren't going to work for them when they're living out in the community. So we've heard a lot from our peer specialists who've been incarcerated and said, I had used survival skills while I was in jail. Those same survival skills are not going to go over very well out in the community. And so I've got to learn how to rewire my worldview and say, this was jail life. Now I'm out in society that has a different standard of expectations, and what do I have to do to not only survive but thrive? So how do I maybe use the skills that I developed that were used for the negative when I was maybe committing illegal acts, and how do I foster those to be productive in society and use some skills of maybe entrepreneurship that somehow got me involved in the criminal justice system? How do I now turn that into a positive attribute in society? And I might become the best salesperson there is using some street skills and jail skills that got me in trouble, but how do I hone those to be a positive? A couple other things. The one that I want to point out is the second one from the bottom there. Practical support accompanying people to initial probation and parole meetings or to treatment meetings. This is what a lot of peer support time is spent doing. Getting over that scary thought with somebody of meeting with my probation officer who's maybe going to be the bad guy. Not that they are, but that preconceived notion of how do I build a positive relationship with my probation officer? How do I build a trusting relationship with them? And knowing that if I can't follow my requirements to the T, how do I communicate that with my probation officer as opposed to them finding out that I'm not doing it, which can result in a violation. Same with treatment. As all peer specialists do, we help our peers learn about advocacy and advocating for themselves and self-empowerment. Coming out of jail, you've been predetermined that you don't advocate for yourself while you're in jail. So how do I get those skills back, and how do our peer specialists help support somebody in learning the ability to do that? This is what our 2-week certification in Pennsylvania looks like for certified peer specialists. I understand here in Texas there's a certification process as well. I'm sure a lot of these topics are covered. My favorite part of the whole training, quite honestly, is the last step, which is graduation. I love the graduations. I love the emphasis that's put on the accomplishment that has been made, and not so much about, I look at the graduation as the next step forward and not looking backwards. So to me, that's the favorite part of the whole entire certification process. But what we did here, and I highlighted for you some of the things that we do in our 2-day forensic training, and this is the combination of all the models we went with and all the policy and procedure we wrote for the Peerstar model. So here are some of the things that we cover, and it is just as intense as the initial certification, because we kind of call it, certification on steroids now, because now we're talking about amping it up to the forensic program. And this is a work in progress. We just went through and revised this because we've added a couple new components for our upcoming January training, one of which is motivational interviewing. We found that people are asking, sometimes I have a difficult time knowing how to start those conversations and how to keep the conversation moving. So it's not a certification in motivational interviewing, but it's just some motivational interviewing approaches that every peer specialist can use to have those difficult conversations. We also talk about how to assess for risk of recidivism. We use some different tools while someone's incarcerated to identify what might put them at more risk for recidivating, so that we can kind of help our peers see those as possible areas that they're going to need to work on. We do training on reentry planning. Number 4 is a big one that we're asked a lot about, is specific forensic services and activities. What do I do? What are those practical approaches? How do I work with somebody who's in the criminal justice system on building relationships? How do I work with somebody in the criminal justice system when they're having housing issues or employment issues? And we have a packet of every suggestion we can think of, and we keep adding to it, from getting people from the field saying, here's what's worked with my peer when I needed to support them in finding a new doctor. And here's the activity we did, here's how we planned it, here's how we did it, and here's how we moved forward. So I'm going to just leave those for you. Our target groups, this is our criteria for services. The first month, we already talked about that being the most difficult time. We also work with non-incarcerated individuals who are simply on probation or parole as a diversionary. And I'm going to turn it back over for our last few minutes, got the signal, thank you, for Dr. Nulton to talk about some of the outcome studies we've been doing.
We'll do this quickly too, and some of this Catherine touched on too, but this was a result of our study with Yale. And it was extremely exciting to have a university like Yale want to partner and cooperate with a provider and PA. So it really came out nice. So you'll see here we started in 2010 and sort of concluded in 2013. We're continuing now some new data, and also with Temple University, Dr. Mark Salzer. If you're reading Recovery, Dr. Salzer and Dr. Jeffrey Drain are both community integration model people, very big in the field and travel a lot. But here you can see from our reentry programs, and I'll go to the numbers, but you see we started 30 to 90 days prior to release. So here's the preliminary findings. There were 300 folks, approximately half male, half female. 86.1 were previously incarcerated. You can see the 50% there. The third had been hospitalized. This is what you start to see in there. A lot of people that have been hospitalized, long histories of incarceration, multiples, stuff like that. Their risk factors for recidivism are high based on the risk toll. You can see 23.7% of the participants in Peerstar's forensic program were reincarcerated, which was a lot less, significantly less by 0.001 compared to what was about 54%. We didn't have that on there, sorry, but yeah, about 54%. So you're seeing a significant reduction once you do fill these gaps and you provide that support network, get all the resources, get the medication. I mean, it's really making sure they're taking care of that point after. You're getting, some what appears to be significant results and increase the likelihood of positive outcomes. All right, and I'm going to stop there, Catherine. That way we're done with that, and I think that'll be good.